Good afternoon, everyone. I am Tricia Shivas, TMA's Director of Development and Strategic Partnerships. I will be moderating this session. I want to thank you for joining this afternoon's webinar on healthcare cost-saving resources. Just a quick bit of housekeeping before we get started today. Phones will be muted throughout the presentation. However, we encourage you to ask questions. There is a chat box located at the bottom of your screen. You can type your questions into this box at any time throughout the presentation. We will have a question and answer period at the end of the talk. This webinar will be recorded and will live on our website for future reference. I would now like to introduce Mary McGowan, Executive Director of the Myositis Association.
Good afternoon. Welcome to the Myositis Association's webinar, Healthcare Cost Saving Resources. I am Mary McGowan, Executive Director of the Myositis Association. For those of you who are not familiar with the Myositis Association, I want to take just a few moments to introduce the organization. Next slide, please. So the Myositis Association is the leading international nonprofit association supporting those living with myositis, their care partners, and the medical community and researchers who care for them. We were launched actually about 25 years ago by a patient by the name of Betty Curie who was living with inclusion body myositis. She began the organization with just 12 patients and has grown to an international organization reaching thousands of patients and clinicians. And the organization celebrated its 25th anniversary last year. And we are an international collaborator of researchers advancing discoveries. Next slide, please. So what we do, we educate myositis patients, care partners, and clinicians. We support patients, care partners, and the medical community. We advocate for research and policies that meet the needs of patients. We're located here in Alexandria, Virginia, just outside of Capitol Hill. We fund critical research, and we raise awareness of myositis internationally with an emphasis on the medical community. Next slide, please. So TMA receives many phone calls from individuals looking for resources to help them better navigate through our complex healthcare system. We've had discussions with many individuals frustrated by high costs in healthcare. Insurance companies often don't cover the cost of durable medical equipment that is needed by many in our community, such as canes, walkers, and shower chairs. This led to TMA reaching out to NeedyMeds to see how they could help. NeedyMeds is a national nonprofit that connects people to programs that will help them afford their healthcare expenses. TMA was very excited to learn that there is up to a 40% discount on durable medical equipment that NeedyMeds has available through the discount prescription card. Through our conversation with NeedyMeds, TMA was also very excited to learn that NeedyMeds had many other programs available to support patients and care partners, from helping you to select the right Medicare plan to getting discounts on over-the-counter medication. TMA has officially partnered with NeedyMeds on their drug discount card in order to help bring reduced costs to our community. If you have not downloaded your discount card, follow the instructions email that will follow this webinar. There you will find a link to download the card for immediate use and a location to mail a self-addressed stamped envelope if you would like to receive a laminated version of the card to keep in your wallet. Now it is my distinct pleasure to introduce Ms. Carla Della Porta, the Director of Education and Partnerships at NeedyMeds. Her professional background has been dedicated to nonprofit organizations. In her role at NeedyMeds, she focuses on educating people about NeedyMeds and the healthcare cost savings resources offered and expanding partnerships efforts. Carla, thank you so very much for presenting information about the services of NeedyMeds on today's webinar. I'll turn it over to you.
Well, thank you so much to the TMA team and Mary for that very warm introduction, and importantly to the audience for taking time out of their busy days to learn a little bit more about NeedyMeds. Again, my name is Carla, and it is my pleasure to be here to showcase the healthcare cost savings resources NeedyMeds offers. Slide. NeedyMeds is a national nonprofit founded just over 2 decades ago, like TMA, by a retired family physician, Dr. Rich Sagel. Rich is still our president. As Mary just stated, our mission statement and what you're seeing on the screen is that we are educated and empowered to those seeking affordable health care. And what you're looking at on our screen also has a statement about how we achieve our mission and our vision statement. But again, as Mary simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously, slide, through our website, needymeds.org, and our helpline, 1-800-503-6897. Slide, please. And one of the most popular and effective ways we do that is with the drug discount card. We partner with other vetted nonprofit organizations, in this case, TMA, to offer a customized drug discount card specifically for the population they serve. What you are looking at is a picture of that drug discount card. The team who's presenting this webinar from the TMA today let me know that roughly 70% of today's webinar audience has not previously used a drug discount card. So we're hopefully going to change that by the end of this presentation by explaining what a drug discount card is, how it works, and why it could benefit you. And I'm sure you've heard of other drug discount cards because there are a lot out there. They can be physical plastic cards or paper cards, both of which can be sent to you, as Mary said earlier in the introduction. And these cards offer people paying cash or not using insurance a way to lower their price of their medications. Slide, please. The TMA drug discount card is ready to use. You simply bring the card to the pharmacy with the valid prescription from your doctor and save. Slide, please. With the TMA drug discount card, users can save between 0 and up to 80% off the cash price of prescription medications, over-the-counter medications and supplies, as long as they're written as prescriptions, and even pet prescriptions if you pick up the medicine at a regular people pharmacy. Slide, please. The card has also been newly updated, so users can save on medical equipment, such as diabetic supplies like needles, testing strips or meters, splints, catheters, and incontinence supplies, mobility devices such as canes, crutches, walker, and wheelchairs, and so much more. You simply go to DME, which stands for Durable Medical Equipment, dme.myvirtualdoctor.com, and then you can search by product category. At checkout, you will simply enter the ID code on your drug discount card and click apply. It's as easy as that. Slide, please. So there are a lot of cards out there. So how does this one differ? First of all, this drug discount card is free and it's anonymous. We do not know who is using the card or what prescription is getting filled. We just track the dollar amount of savings and the number of times our drug discount card is being used. This card requires no activation, no enrollment. There are no residency, income, or insurance guidelines, and it never expires. And chances are you will find a pharmacy in your area that accepts the drug discount card, since it is accepted at more than 67,000 pharmacies nationwide. A few other things to keep in mind. Not every drug or prescription will have a discount, and when a discount is offered, they will vary from from month to month and from pharmacy to pharmacy. 85% of the time the card is presented to the pharmacist, a discount is provided. And that discount is usually about half off the cash price. So the big question is, who can use this card? Slide, please. Simply put, anyone. The only rule is that it cannot be combined with insurance. So if you're uninsured or you don't have drug coverage, you can use the card anytime. If you do have insurance, you may choose to use the card instead. And you may choose to do that, for example, if you find that a particular medication that you need is not covered. Maybe you find yourself in a coverage gap, or maybe you have a high copayment or high deductible, or maybe you've exceeded a cap for drug coverage for the year. I also want to point out that if you have drug coverage, it's worth comparing the price you would pay against the price the drug discount card would offer. 5 to 10% of the time, the drug discount card will actually offer you a better rate than insurance. So a few more things I want to point out to maximize savings with your drug discount card. Slide, please. To find pharmacies that accept the drug discount card, you can click on the drug discount card box on the left-hand side of NeedyMeds.org. At the bottom of that page that will pop up, you will find a pharmacy. And again, chances are you're going to find one convenient because, it's accepted in more than 67,000 pharmacies nationwide. Now, you can also compare how much your prescription will cost at different pharmacies using what's called the drug pricing calculator. And that is also on the left-hand side of NeedyMeds.org, right above the Get Your Drug Discount Card box. And importantly, if you don't have access to the internet, or like many people are simply more comfortable speaking with an actual person, you can call our expert call center counselors. And that number is highlighted on the top right hand of our page. It's 1-800-503-6897. And they can find out all of that information for you, including what pharmacies in your area accept the drug discount card and how much will your prescription cost using the card. Do keep in mind we're in Massachusetts, so we're on Eastern Time, and we are open Monday through Friday, 9 a.m. to 5 p.m. And TMA is making things really easy for the audience today because, as Mary said in the introduction, you will be receiving an email after this webinar with instructions and a link about downloading your own drug discount card. And if you should choose, requesting that they mail you a laminated version of it. And again, keep in mind there is no identifying information on that card. So that means it can be shared with family, friends, neighbors, loved ones. And no doubt TMA would also encourage you to print out and hand out as many as you like. So in addition to the drug discount card, the TMA has partnered with NeedyMeds to make sure you are aware of other ways to save on your healthcare expenses. Slide, please. If you go to NeedyMeds.org and click on the Patient Savings tab, a whole bunch of different categories pop up with ways to help you save on your healthcare expenses. Slide. What you're looking at now is a list of all the categories that were just on your screen, and they're listed in the same order from left to right, exactly the way they would pop up. The one at the top, prescription assistance programs, and the one at the bottom of the list, government programs, they're highlighted because those are the ones I'd like to talk to you about today. I encourage you to check out the other resources further by browsing our website, signing up for an upcoming NeedyMeds overview webinar, or simply giving our expert call center counselors a call. So let's talk about prescription assistance programs. Slide, please. Now, under that Patient Savings tab, slide, please, on the top left, you will see a category dedicated to prescription assistance programs. Slide, please. Prescription assistance programs are programs that are usually supported by pharmaceutical companies and most of the time offer free, and some of the time offer deeply discounted prescription drugs, usually name brand, to those that qualify. Of course, not every drug will have a prescription assistance program. When a program is available, eligibility requirements and applications will vary from program to program. One common requirement is that the patient's healthcare professional or doctor usually needs to be involved by providing a prescription, signing the application, and submitting the documentation. The reason I wanted to point out prescription assistance programs are because they by far offer the most savings compared to any other savings options, including a drug discount card or a coupon or even a diagnosis-based assistance program, which is one of the other categories I suggest checking out further under that patient savings tab. Also, don't assume, like I did before I worked at NeedyMeds, that just because you have insurance or drug coverage, you automatically wouldn't be eligible to apply. Although that is often the case, as I stated just a moment ago, eligibility criteria will vary from program to program. On our website or by speaking with one of our expert counselors, you'll be able to find out if you are eligible. Basically, if you are on any brand name prescriptions, a prescription assistance program may be right for you. It may be a great way for you to save money. And we make finding out if you qualify just a quick click of the mouse or a phone call away. So I hope you agree it's worth checking out. So let's talk about government programs. Slide. So under the Patient Savings tab, slide please, on the bottom right-hand side, you will see a category dedicated to government programs. Under the government programs category, slide please, you will find all of the state-sponsored programs that offer healthcare savings options. But I really wanted to point out this section today because for those of you that are beneficiaries of Medicare or Medicaid, you will find exhaustive information on those programs, which can be really helpful. But I also wanted to highlight that we also have a complete listing of all national state health insurance assistance programs. These are federally funded health advisory programs that provide health insurance counseling to Medicare recipients and their families. We all know that navigating Medicare can be confusing and difficult, so please check out our listing to find a program in your area that can help connect you with a location or an individual so you can get all of your questions answered. So again, the prescription assistance programs and the government programs are just a sampling of some of the healthcare cost savings resources you can find under that Patient Savings tab. And I do hope you check out NeedyMeds.org further when time allows. Now, I'd like to move on to pointing out a few other resources we thought you would find interesting as well. We're going to talk about a NeedyMeds-sponsored website that provides answers about how to dispose of needles safely. We're going to talk about a tool that makes it easier to track and manage your health. And I'm also going to showcase another NeedyMeds site that will help you take action to prevent the misuse and abuse of opioids. Slide, please. So safe needle disposal, and I know we're really switching gears here, but safe needle disposal is a public health and safety issue that is commonly overlooked. That is why NeedyMeds sponsors safeneedledisposal.org, which is a website that allows you to search easily in your area for ways to dispose of home-generated sharps. And as you can see, you can search simply just by typing in your zip code. Slide, please. NeedyMeds also offers Storylines. Storylines is a free self-care app that makes it easy for you to track and manage your health conditions. Storylines can act as a medication reminder, a symptom tracker, a daily mood tracker and journal, a vitals tracker, meaning you could track things like your weight, your blood pressure. It could be a pain rating scale, and so much more. And one question we get a lot is whether or not this app does track with other fitness devices like a Fitbit, and the answer is yes, it does. And you can download this app for free on Google Play or on iTunes. Slide, please. And the last resource I want to mention is Talk About Your Medicines Month. NeedyMeds also hosts a website that you're looking at a screenshot of right now called BeMedWise. BeMedWise promotes the safe use, storage, and disposal of medicines for better health. And like NeedyMeds.org and Safe Needle Disposal, I encourage you to check this out further when time allows. So for the past 34 years, BeMedWise has sponsored the October Talk About Your Medicines Month. This awareness month spotlights healthcare issues impacting communities far and wide. BeMedWise has previously focused its Talk About Your Medicines Month themes on things such as think before you drink, communication is key, and educate before you medicate. Slide, please. This year's theme is taking action to prevent the misuse and abuse of opioids. We've created a website, talkaboutyourmedicines.org, to showcase expert resources for opioid safety through the ages, from keeping toddlers safe around meds to ensuring adults prescribed opioids are responsible. This website has a brief webinar on the topic, expert resources, and a downloadable free toolkit. Educating yourself may even prove life-saving. Slide, please. So I want to thank everybody for taking time out of their day again to learn just a little bit about NeedyMeds and the depth and breadth of the resources that we offer. And what I really want to stress is, again, if you want to just reach out to speak to a live person and have any questions about what I covered, or just a question about how in general you can save on your medications or other healthcare expenses, please don't hesitate to reach out to our call center counselors. Thank you so much, and I look forward to answering any questions that may come in.
Thank you so much, Carla. This was such an informative webinar and so much information and so many resources. And I know you barely scratched the surface on a number of the resources that that NeedyMeds has to offer. And so we really appreciate you taking the time to walk everyone through all those wonderful resources. And thank you for providing the guidance on the phone number and the different places in the website to go. We'd now like to take a moment here to do some question and answers. And as a reminder to everyone, you can ask a question by typing your questions directly into the chat box, which is located at the bottom of your screen. And I will be helping to facilitate today's question and answer session. I wanted to start with a question that we did receive. How do I find the cheapest place to buy medication in my local area?
So that's a great question. So one of the first things I would suggest is to first check out NeedyMeds.org, of course, or call our counselors, because you may be able to find a prescription assistance program or coupon. Such programs are available to everyone as long as they reside in the U.S. It is not specific to a geographic location. And if you don't have luck with that, you can use your TMA drug discount card. And again, you can find participating pharmacies on our website, or you can give our expert call center counselors a call. One other thing I did want to point out, under that patient savings tab, there was a whole host of different categories where you can save on medications. One of the very popular destinations is a category called diagnosis-based assistance programs. And that's exactly what it sounds like. Those are programs that will let you know if there are any cost savings programs available dedicated to a specific diagnosis. Those are based on geographic regions. But the great thing is if you do a search under the Diagnosis-Based Assistance Programs database, it will let you know per state what programs you are available for. What programs you are eligible for. The other thing I want to point out is when you do that diagnosis-based assistance program search, all of the programs that are national will come up first. And what that means is, regardless of where you live in our country, you will be eligible to apply. So I hope that helps.
Great. So we've received a couple of questions for clarification for Medicare Part D. Maybe you can help to help people have a better understanding of how the card might be used with Medicare Part D. So there's questions about whether or not a participant would be able to use it when the participant is not in a donut hole. And then furthermore, if the person has a deductible plan, do the purchases made through NeedyMeds apply towards that deductible?
Fantastic, and that's an important question. So the answer is the drug discount card can be used for Medicare Part D programs, whether you're in the donut hole or not. Here's the thing, though. The money you spend using the drug discount card will not count towards getting you out of the donut hole. So let's say it's the beginning of the year and you're still trying to get out of the donut hole. don't use the drug discount card. Don't save because you're trying to get out of that donut hole. But if it's the end of the year, let's say it's November, December, and you know you're not going to get out of the donut hole, you can use the drug discount card to save on your medications. At that point, you might as well. So I hope that answer helps. So let's pick apart the second part to that. That's it right there. If a person has a deductible plan, do purchases made through NeedyMeds or the drug discount plot apply towards the deductible? And so that's another really important question, something we really have to stay on top of at NeedyMeds, because the answer to that has changed over the years. And the answer is, unfortunately, no. The money that you spend using cost savings programs can usually not be counted towards your deductible. You will find the fine print on the coupons or the drug discount cards. On the prescription assistance programs. But if you use the drug discount card, that money will not be used towards getting you towards your deductible, which can be frustrating.
Great. And there was a question about the way the payment is made with this card. And so just to clarify, the payment for this is not just cash only, right? This is a regular. This can be used as a regular prescription card. You can pay with any mechanism that you would typically pay at your counter at your pharmacy.
I'm so thankful to the audience member that asked that, because when I describe the drug discount card, I say you can use to save on any cash payments. What I really mean, I'm not talking about how you pay. You know, it can be cash, it could be check, it could be credit card, it could be debit card, however you normally pay. It doesn't actually have to be cash. What I mean, and I'm so thankful to have an opportunity to clarify this, is when you're paying not using drug coverage or insurance. That's what I mean. So I can see how that would be confusing, and I'm really glad you pointed that out, because moving forward I will not use that language anymore. So yeah, when I say with cash payment, I mean if you're not using drug coverage or health insurance coverage.
Great. Okay, so so we talked a little bit about this before, but another question that we have is, so using the navigator that you have on the website, do people have to travel long distances typically to find somewhere where they would be able to find a cheaper priced medication using the discount card?
So that's a really important question. The answer is because the drug discount card is accepted in more than 67,000 pharmacies nationwide. That does include all the major national chains, Rite Aid, Walgreens, but it also includes local mom and pop type pharmacies. And what you can do is you can do a search in your area with the drug price pharmacy finder tool to see what pharmacies are available in your area, and you can do it by searching your zip code only, and then you can expand beyond that if there isn't anything within exactly your zip code. You can do a 5-mile search, 10-mile search, 15-mile search, and obviously, depending on whether or not you have transportation, that would make things easier. But I suggest, again, always reaching out to our expert call center counselors, because maybe we can connect you to a prescription assistance program, a diagnosis-based assistance program, a government program, or a coupon that will help you save on your medications. And most of those options are not based on where you live. So do keep that in mind.
Great. We had a question again about the use of the durable medical equipment, the card for the durable medical equipment.
Sure.
Is it possible for you to give a little bit more of a description of how that works? And perhaps, LaDonna, perhaps you could take us back to that slide so folks could see that website one more time.
Yeah, I'd be happy to point that out. So just this past year, the drug discount card has expanded to include, and LaDonna, I believe that is slide 13. It has expanded to include allowing users to save on medical equipment. And how you do that is actually on a website. What you do is you simply go, you have your drug discount card. Mary sent you an email, so you printed out your drug discount card, or maybe you got in touch with TMA and they mailed you a laminated one. On the back of that card, no, actually, excuse me, on the front of that card, there's a bunch of information. It'll have a BIN number, a group number. And those numbers are important because those are the numbers that the pharmacy is going to need. Anyway, you've got your card in front of you. Then what you do, and if you could, that's not it. Let's see, LaDonna, if you can find it. It's maybe if you could do a couple of slides back. And what you would do is you would go to a website, www.dme.com. And what will happen is what will pop up are a whole bunch of different medical equipment categories. You'll see categories for things like, let's see, diabetic supplies like needles, testing strips, and meters, splints and catheters, incontinence supplies, mobility devices such as canes, crutches, walkers, and wheelchairs, and so much more. And once you get to that website, which is super easy to navigate, like I said, you'll literally see those categories pop up. But there'll also be a search bar where you can type in whatever you're looking for. Once you find the product, the medical equipment you are interested in purchasing, what you would do is you would simply go, and it's a few more back, LaDonna, if you could find it, that would be great. And what you would do is you would, again, you search by product category, or you can type in what you're looking for. And then once you go to checkout, you will simply enter the ID code on your MTA drug discount card. And then once you hit that ID code, you will literally hit a button called Apply Code. It's as easy as that. And if you have any questions or want me to send you those instructions via email, I'd be happy to do that as well. But I hope that explains it. And please don't hesitate if anybody has any other questions.
Great. So while we're getting that slide back up for everybody, thank you for reviewing back how that works and that people are able to look through that. So
that's the one.
That's it. There we go. So there it is.
Thank you, LaDonna.
dme.myvirtualdoctor.com. Thank you. Thanks so much, LaDonna. Just beyond the card, could you say a little bit more about how people might be able to use NeedyMeds on how they might be able to use that to help navigate some of the other resources? For example, right now is open enrollment for Medicare, and how might that be really helpful for some folks if they're having some trouble? You mentioned that there are some people that they might be able to call, but what are some of the ways that it might be really helpful? Just if you don't feel like calling somebody in particular, how might it be helpful for somebody to just kind of navigate through the website to get through some of those resources?
Absolutely, that's really important. So again, under that patient savings tab on the NeedyMeds.org, once you click on that patient savings tab, a whole bunch of different categories will pop up on ways to save. On the bottom right hand of that page, once it pops up, you will see a section dedicated to government programs. And government programs, it's exactly what it sounds like. You will find all state-sponsored healthcare savings programs available per state. But on that page, you will also find a whole bunch of things. You will also find pretty exhaustive information on both Medicare and Medicaid. You will be able to find all of the links you need to find out the details you need to know as a beneficiary of Medicare or Medicaid. On that page, on that government program site, we also have, because if you're applying often to government programs, they want to know the eligibility is based on income. So to make that easy, we put a link So you can just click on it, and it would take you to a page where you can request your tax returns, which is really easy. And we also have there a poverty level guidelines calculator, because again, when you're applying to a state program, often they want to know income, and to validate or verify your income, they're going to want to see your tax return. So we put a link there, and they're going to know where do you fall in the federal poverty guidelines, and so we have a calculator there. So again, you can find all of the links you need about Medicare and Medicaid under that government programs category. And you will also be able to find a complete listing of those SHIP sites. And again, those are state health insurance assistance programs. And those are federally funded health advisory programs that provide health insurance counseling to Medicare recipients. And that's really important because maybe you'll be connected to a person and somebody you can meet in person to talk about your Medicare benefits, or you can literally visit the site for the SHIP site in your area to find out more information, as Tricia said, in case you don't want to just pick up the phone right now and speak with somebody. But I really can't stress how helpful those SHIP sites are. So I do think it's worth checking out. I hope that helps.
Yeah, very helpful. So we just received another question about if you could say a little bit more about the transportation assistance sites that you have identified on the website and how you might be able to provide people some more assistance with that.
Sure, absolutely. And again, I'm so glad to our audience member for asking that, because this was, as Tricia said, an overview of the breadth and scope of the cost savings programs NeedyMeds offers, and that can be overwhelming, which is why I didn't want to go into too much detail about all of the cost savings programs available under that patient savings tab. We talked about prescription assistance programs, we talked about government programs, but I'm so happy to see that people have noticed the other cost savings programs in there. And what you're referring to now is a section dedicated specifically to medical transportation. That category was actually just added in the very beginning of this year, I believe, or the very end of last year. And the reason we added an entire category for medical transportation is because our users let us know that oftentimes getting back and forth from a doctor or specialized facility can have its own difficulty. So because of that, we put together an entire section that will help you find medical transportation in your area. And what I mean by medical transportation is certainly you will find things like if you need to fly across the country for a certain type of treatment, but it may also consist of things in your area such as a voucher to take public transportation, or it may include actually getting the transportation from the doctor or specialized facility. And you can search in your area by diagnosis and geography. So check that out. And again, that's under the Patient Savings tab, and it's towards the bottom in the middle section. And if you have any questions or confusion, again, our expert call center counselors are here to help. 1-800-503-6897. And please do be vocal about your experience on our website. We try our best to stay up to date with what our users need, and we can't possibly do that unless you're vocal about your experience. So thank you again for that question, and let me know if there are any others coming in.
Sure, yeah. So as a reminder, if there are any additional questions that anyone has, you can type your question into the chat box. Very located at the bottom of your screen, and we are at this point out of questions that we have seen come in from our audience. So I would, LaDonna, if you can move us towards the end of the webinar, and then we'll see if others come in while we're waiting for that to come in. In the meantime, I would love to say thank you to Carla again for this really wonderful introduction to NeedyMeds and the resources that are out there into the drug discount program and how that is used. And again, if there are additional questions, don't hesitate to reach back out to NeedyMeds. They're available both by phone and on their website. I'm sorry, LaDonna, if you could pop over to the end of the webinar. Next slide.
And while, this is Carla again, everyone, and while LaDonna is moving the slides forward probably to showcase the contact information, I do again want to thank everybody for taking time out of their busy days to listen and learn a little bit more about what NeedyMeds is and hopefully how we can help. And a huge thank you to our partner, the TMA, who has a very dedicated staff who is constantly trying to find ways to help the population they serve live a healthy life. So thank you for having me today.
Great. So we're just moving through the slides at this point. But what I will do is I will say again, thank you very much. And this will conclude our webinar. We do want to let people know that you will have a follow-up email. As Carla had mentioned, you will, yeah, LaDonna, you can go to the next slide. Thank you. You will have a follow-up email that will be coming to you, which will include information on how to download your discount card, as well as a survey. So we do ask that you please take that survey. We'll have additional information that will be useful to both us and to NeedyMeds. Our next webinar is going to be on November 20th at 7 p.m. Eastern Time. We are partnering with Myositis Support and Understanding for this webinar, and it is for caring for the care partners for Family Caregiving Month, and we hope that you will be able to join us for that. It has a lot of different folks coming in to speak with us. We have folks from respite care speaking, people from WellSpouse, as well as Family Means coming to give some resources. And a couple of the topics include coping with loved one's new diagnosis, respite, getting through the holidays, wheelchair accommodations, asking for help in other areas. Next slide. LaDonna, next slide. So this concludes our webinar, and we do want to just put this up for information for you. We have more information with the myositis.org, and you can join TMA. Please do join TMA to get information about webinars like this one, or webinars such as the one that's coming up on the 20th. We also have information that you can get monthly from our e-blast, as well as our Outlook magazine. We also have information about the latest research. So if you join TMA at the Join TMA tab, you will get that information. For more information on NeedyMeds, please go to the www.needymeds.org website, and please remember to take the short survey that follows. Thank you again all for joining us for this wonderful webinar, and we hope you found it very helpful and useful. This again will live on our webinar website, on our TMA website. So if you want to revisit any of the issues that were brought up here, you can find this on our website. Thank you and have a wonderful day.